Good evening, everyone. How is everybody doing? Natural fertility. I'm talking about natural fertility. Natural fertility coaching is coming up, so I am promoting natural fertility coaching. If you're a couple trying to get pregnant and have issues getting pregnant, staying pregnant, or other issues on your journey while you are on the journey of fertility for weeks, months, or years, then this is the life for you. If you're interested in holistic solutions, if you're interested in what else can you do to improve your health, well-being, mental health, physical health, sexual health, every health possible for you to be getting the results that you want. I will also show you the things that you can download from our website for free to help you. So I'll show you that as well. But if you are a couple or a woman who's trying to get pregnant right now and have issues related to that, feel free to ask a question, share your journey, share your experience or your thoughts, whatever you might be thinking, and you need another person to think with you, then I'm happy to help you and answer your questions. So this is the website. My website is called ashishveda.uk. My name is Ashish and my clinic is called Ashish Veda. So website is ashishveda.uk. And if you go to website here like this and you go to the shop section, it's the green screen. Okay, if you go to the shop section and you can see all these guides, okay, that you can download for free. There are, I think, 5 or 6 guides now. There is another guide that we're putting up. So guide related to, there are fertility recipes, there are 5 herbal herbs that will support your hormones, there is egg quality guide, there is miscarriage guide, there is guide related to sperm health. Okay, all sorts of guides are available. Natural therapies also for fertility, therapies that we do in our clinic also listed here, so you can check out what kind of therapies do we use. Yeah, so those you can do. And natural fertility coaching, that next season is starting in April, so I will tell you about that as well. Use a long number. I would love to have another kid, but I believe for you having chemotherapy might be a problem. You can still, depending on the situation, and it is a complex situation if you are going through chemotherapy, if you have sometimes the fertility function, ovarian function still does not get as affected, you may still be able to have a child. If not, then it is surrogacy is the option if you still do want to have another kid. But with chemotherapy, yes, it affects a lot of things, so it's not as straightforward. But wishing you a lot of health and hope that you take some natural medicines afterwards. Okay, once you've gone through the whole thing, and wishing you health and healing with that. Do reach out to us or to anybody, but for natural therapies, okay, to heal forever, so that it does not come back and you are healthy afterwards. Question? No. Okay, you are welcome. So natural fertility coaching, I am talking about natural fertility coaching. We started one lot in January. So generally I coach for 3 months. 3 months is at least minimal time where you can make some changes in your habits, and you keep those changes and also have see some effects of it in 90 days, which is 3 months. So the next 12 weeks, we are starting on 4th of April. And I am talking about it, sharing about it, because the first 4 weeks of those sessions is free for everybody. Anybody can join. Wherever you are, it's online, so you can join and learn whatever those 4 weeks I will be teaching you. And in addition, if you then want to continue, you can continue. If you don't want to continue, you can take that knowledge away with you and still do everything possible what you can do in your own resources. Yeah. So natural fertility coaching, anybody wants to join, inquiry at ashishveda.uk. Inquiry at ashishveda.uk. Send me an email now and I can check. I've had few people join this morning. And yeah, if you are looking to join, then reach out. I had an ectopic, now 9 days, missed period, getting cramps, headache, back ache, still testing negative. Right. A heart. What's the question? Savannah, UGC creator. Used to take me max 12 months to fall pregnant. The first time it's been 17 months. As Savannah, if you are able to really kind of pinpoint that, within a year you would be pregnant, you still are blessed. But yeah, you think it's because you're mid-30s, you and your partner both, right? It's a combined issue, so it's not just your issue. How is your health like? So you have children, yeah? More children, or not? You mentioned you had 2 back-to-back ectopics, right? So you have the tubes, one of the tubes. Where can I join? Right, inquiry@ashishveda.uk. Send me message now. inquiry@ashishveda.uk, and I'll send you the details. We are starting on the 4th of April. Okay, and the whole fertility coaching is 12 weeks, out of which first 4 weeks is free because it's foundational work. Yeah, and you can join wherever you are. Your partner can also join. You both can learn and start working on your foundational health. Then if you want to continue, you can, if you want to continue, you can continue further with paid consultation or other things if you want. Otherwise, if you're happy with that, then good. Right, Deborah, Deborah, who you know who you are. I've got your email. Sending you healing. I've had ectopic. Before I had my twins, I had ectopic as well, so I don't have right side tube. It erupted. But because I'm a practitioner, I just caught it right on the time, in time, and then got to the hospital in time. But yeah, I know the pain and everything that can be there. Was in hospital for a week after that, so lost that tube. But had, pregnancies after, so it is very much possible. Yes, Savannah, so what's your question? Mid-30s, what is your health like? Your partner's health like? Inquiry@ashishveda.uk, talking about natural fertility coaching that is starting on 4th of April. So prep yourself before we start that. And nearer to the time, a week or so prior to that, I will be sending more instructions. But those 4 weeks are free. There will be 30-minute session every Saturday. For 4 Saturdays, you can join. And if you, yeah, and you can join. Yeah. All right. So, question. Natural fertility is what I share. I talk about natural fertility, natural ways to improve your health, natural ways to increase for both partners, not just only women. Men also need to improve their health. Absolutely equally. What you do, he has to do exactly the same, even when you think you are 100% fit. Okay? Because fertility is a combined effort. The higher the health, the better the health of sperm, the better the quality of that embryo. So he should also be improving. So if you're a couple right now going through, and most women also don't know that their men need to improve their health, but they do. Even if he has numbers within the range, but they are on the lower side, then your husband, your partner, your boyfriend, he needs to improve his health. If you want to get pregnant faster and healthier and have a healthy pregnancy, no recurrent losses, then get him to be taking herbal medicines and improving everything about him also. Who else has a question? Natural fertility, natural ways to improve, enhance your fertility. Natural therapies work really wonderfully well. We do natural fertility massages, we do Ayurvedic colonic therapies called Basti, we do internal therapy, Uttar Basti, which is one of the treatments we do to open tubes. We do that. I give herbal medications which you can use, take by mouth, take vaginally, take anally. There are all possible ways, however, we can get herbs, to work for you. What about varicocele in male? What I have not worked on a man with varicocele. I've worked on men with low sperm quality and improved it every time. So but I am 100% sure we can do natural. There must be other solutions. Once I have a case, I will have to dig into the data and see what we can do. But there are so many ways then to improve, and especially even if there is varicocele, in which case you might have to go through operation and collect a sample, right, to go through IVF. The fact that he can improve rest of his health will improve the sperm. Yeah. So that is something we can still do with natural ways of improving health, and herbal medicines can do that as well. Structural issues have to be, of course, surgery has to be used for that, but the rest of the health still needs improving. Does that answer your question? Was that the question? Natural fertility is what we are talking about. My name is Ashish. My clinic is called Ashish Veda. We are based in central London in Harley Street. We have been there for last 10 years supporting fertility health for both men and women, for both partners, especially obviously more for women because it's women who end up doing all the treatments. So for last 10 years, I have been doing that. What do you think about inositol for trying to conceive? Melly? I think inositol, the data shows it works really well for a lot of people. And I think, I can't fully remember where I read the data, but it works for 50% or so of the people. My opinion would be that if you do want to take inositol, work on your gut health. There are herbs that can do the same thing. So if you're taking inositol, if it has been prescribed by your doctor, right, still improving your health, taking herbal medications that can work on your insulin resistance, because there are herbal medicines that can work on your insulin resistance like inositol, but they are better because they are natural. So you can use that in combination and still work on your diet, especially your diet, your nutrition overall. That can then work together. If you're only relying on inositol, medicines can only take you that far. If you're not changing your own dietary habits, if you're not changing your lifestyle. What herbs do you recommend? I don't give out names of the herbs because I prescribe herbal medications after a consultation, but there are herbs that you can take. So you can go to a herbalist and then take something from them as well, get a prescription, also discuss everything, because it is a lot in how the whole nutrition works. It is not just only eating nutritionally good food. It is about eating at the right time, right portion size, right way of cooking it, if you haven't looked into that yet. Have you? Or you just recently been diagnosed or just recently looked at inositol? You are welcome, Melly. Then you don't, if it is not particularly for PCOS or anything, then you can, or you have PCOS, right? Okay. Even within PCOS, insulin resistance can be tested. And if your symptoms are still fairly controlled symptoms, the fact that you're trying to conceive, working on everything else, and especially the diet and nutrition with natural ways to improve it, would be a better way of doing it. Inositol is basically an antioxidant. Yeah. All my labs were normal, just low vitamin D and low progesterone. Okay, so you're ovulating, yeah? Even though you have PCOS. You're ovulating? Yeah, so inositol is one thing, but I'm a natural medicine practitioner, so I'm very biased towards using natural things, natural herbal herbs, for example, and they are superior than using anything chemical based, right? Inositol is a chemical solution. So working on your own health is going to give you better chances. Positivity, I have ovarian cysts history. Got 2 laparoscopy and 2 open surgeries and got big cyst again. Okay. Melly, you cannot buy the herbs that I recommend. The herbal medications that I use are Western herbal medicines, or I also use Ayurvedic medications. So you will be able to get those prescribed only after a consultation. But I'm gonna start selling on TikTok soon, and gonna start. Then you will be able to get some of those. But the best way to go forward, if possible for you, is to have a consultation, learn about everything else, learn about your body mind constitution, learn about your dietary changes, everything else, and then also get herbal medicines. You're following me. You should join my fertility coaching that I'm starting in April. Join. First 4 weeks are free. Learn a little bit about because first 4 weeks I'm going to talk about body mind constitution according to Ayurvedic medicine. We call them doshas. What kind of body mind do you have? What kind of gut do you have? Are you a hot person, cold person, warm person, phlegmatic person, nervy person, calm person? Finding out, the more you find out about yourself and your gut, the better it is that how can you utilize that information to make your day nicer, your day, optimize your day, your productivity, your fertility, right? So join us for 4 weeks. It's free. What should I do? I removed my left ovary. Positivity. When you had cysts last time, did you take any herbal medications? Did you take any advice from any natural practitioner? Did you do anything to improve your diet, your lifestyle? If not, cysts come back very regularly, because that's what they do. Any growth, once they get used to in your body, they keep coming back. Okay. So inquiry at ashishveda.uk. If you want to join natural fertility coaching, 4th of April, 4 weeks free, and rest, you can decide what you want to do. Stay with us or take that information and work with your health yourself. How to be you? Any supplements you recommend while trying to conceive? Okay, I don't recommend supplements generically. There are supplements all over the internet. You can get a whole list. Go to ChatGPT, it will give it to you. My recommendation is first you get your health assessment done fully, properly, you and your partner, both of you. I prescribe herbal medicines, which I prescribe after a consultation. So that should be the route. If you have you had any investigations done yet? No. But when I checked, I'm not. Patience, if you had typed in anything else, I didn't get that comment. We also have number of free guides which on my website. My website is ashishveda.uk. So if you go to my website, you can download those free guides as well. Anything generic, if you're looking at somebody who can just tell you, okay, take this one thing and this one thing is going to work for you like magic, generally is not the case. And you should not be taking that kind of risk with your health, something as valuable as your fertility, right? You want to The first step is you want to be with the practitioner. Whether you take with that practitioner just one session, few sessions, more sessions, or you go all the way in. For example, if you want to work with me, you can have a consultation and consultation only. Consultation involves 4 weeks of supervision, which is included in that. I will give you lots of almost everything that you can do yourself. Yeah. Dietary changes, lifestyle changes, breath work, exercise. We work on all sides of your health. Yeah. That's one first foundational step. Then if you want to take herbal medicines, you take herbal medicines with me. If you then want to take natural therapies that we do in the clinic, you take natural therapies. If you want to also have coaching with that, you have coaching with that. So you can take all these steps. Okay. That's what you should be doing with your whoever is the practitioner. It's not like just give me one supplement to, because health does not work like that. There is no one single supplement, even when there are, women who are taking hormones, for example. I have seen patients where they have taken all the maximum dosages of hormones that they could take, right, during IVF or otherwise, or women who have taken Clomid, even it's not recommended after 3 months, who have taken Clomid for much longer. It's not that body is going to respond to it, because too many hormones, body shuts down if you're giving too many hormones mindlessly, or any medication for that sake. There has to be a finer balance, and you cannot create that for yourself unless you are a practitioner and you have immense knowledge of how to go through this whole complexity of fertility medicine. You need a practitioner with you. So I always, anybody who has heard me few times now must have heard me the same thing, talking about the same thing. Join a practitioner. Somebody offering free coaching session like I'm offering 4 weeks, join. Learn a little bit more, right? That's the starting point. Starting point is not just recommend me a herb. My friend is 43 years old and she already have a girl, right? Is that possible? She can get pregnant naturally? Nisha, yes. Short answer is yes. As long as woman is menstruating, is ovulating, she can get pregnant perimenopausally, even sometimes occasionally, kind of just menopause has just happened, still she can get pregnant. Right? But long answer is, if she is not healthy, if partner is not healthy, his sperm also need to be very healthy. When you are trying to get pregnant over 40, men's sperm has to be also super healthy so that it can work better for them. So if she is not healthy, then it is going to take longer. It is still possible, but that in itself is not enough. Yeah. Natural fertility coaching is starting on the 4th of April for 12 weeks. First 4 weeks is available to all of you, free. Everybody who is here should join us. Send me a message, send me an inquiry, email me, or send me a DM here on TikTok. My name is Ashish. My clinic is called Ashish Veda. We are based in central London in Harley Street, number 2 Harley Street. And you come and have consultation there. You have all the therapies there if you are coming to see me. And we see couples as well as women and men. We are a private natural healthcare, natural fertility care clinic. Samuel, please, I have used castor oil. Can I get pregnant again? I have no idea about your health. How can I tell you an answer? Last stage is menopause. That's the last stage. When you stop your period, then you can't get pregnant. Yeah. Tell your friend to join our natural fertility coaching. If she's still interested, her and her partner both should join. any more questions, this is going to be a short live. Generally, I was talking earlier in the morning 12 o'clock. So that was a longer live. This is going to be short live. Anybody has a question, please feel free to ask. Join us for free coaching for 4 weeks. Learn about your health and well-being, about your body and mind. You'll be blown away. You know, how much you don't know about yourself. How do we know about we are on menopause? When you start to stop your period, Nisha. When you start to stop your period, when periods start to stop. They start to become every 2 months or stop, and then after 3 months they come, something like that, you know. They become more haphazard. With many women, there are more complications. Okay, a lot of women have a lot of complications. Period become heavy, or that the fibroid is starting to develop, or other complication maybe, or that women start to have perimenopausal changes. They start to gain weight. They start to have other issues related to perimenopause. Yeah, but period is the biggest sign. Okay. Well, one person has reached out. Anybody else who wants to join us? We still are starting. I think it is about 3 weeks from today. Today is 11th, and we're gonna start on the 4th. So yeah, roughly about 3 weeks. Thank you for sharing gifts and likes and everything. Thank you so much for doing that and putting this live in front of other people. Please share more. Share as much as you can, because it is for the benefit of other women who are going through this journey alone. Most women are going through this journey alone. I've been doing this for 10 years, and it is amazing. Even when you have the most supportive partner, it is still really, really difficult, because things are happening in women's bodies, and it is really hard to go through the whole, you know, like I remember being in hospital by myself. I mean, I'm not scared of hospitals because I'm a practitioner. But for those who don't like hospitals, to be in there by yourself, or partner is not allowed to come in like it was a few years ago, or even now maybe in some places, or that you don't have supportive partner, it is very difficult if you don't have other support. Yeah. So reach out. And anybody who's looking for a consultation, or want to do more work, or want to really go deeper into it and use natural therapies, they can really be life-changing. Most of my patients, it is life-changing for them. So these can really, really help you. If I'm not your practitioner, find a practitioner closer to you who you can work with. Naturopath, functional practitioners of functional nutritionist, I think they are called, Ayurvedic medicine practitioners, Ayurvedic therapists, any other natural health therapist, TCM practitioners, acupuncture practitioners. There are so many reflexology practitioners. There are so many ways of doing natural medicine and natural holistic medicine. Whatever works for you, whatever you like, do that. So one more time, I will show you my website page where you can go and download guides. It is called ashishveda.uk. As you can see, okay, here, yeah. And you can see these guides here. These are free to download. You need to give your name and email and download these. So we have 20 fertility boosting vegetarian recipes. We have got 5 natural herbs to support your fertility journey. We have got natural guide to enhancing male fertility. We also have got guide for fertility after miscarriage, gentle healing after miscarriage, improving egg quality using natural medicine and therapies, and natural therapies for fertility that we do in our clinic. So you can get a copy of all of these today, inform yourself, learn a little bit more, get deeper into how can you heal yourself. Okay, healing is the point. How can you get deeper into your health? Just not having any disease and just kind of getting by is not life, you know. It is when you are thriving, when you're full of life, when you have got so much energy that you wake up inspired. That is health. Health and well-being. Sleeping better, sleeping and waking up feeling more nourished, is that's the kind of health we are looking at, and to have that health forever. And the more I know a lot about natural medicine and also a lot about health, but the more, even more and more we are looking at data and science and more studies, health is, you have to work on your health forever. You cannot take your foot off your health. You have to keep improving your health. If you're not improving, it is going downhill. Hi, doctor. Hello. How can I help? This month I'm not getting period, right? Today is only March. It's 11th today, isn't it? It's just 11th March, so it's on the dot. No? Thank you for the hearts. Whatever is your name, fabulous. Okay, no more questions. That's great. Maybe tomorrow. Your name is Monica. Thank you, Monica. Please give advice. Advice about what? Rajvinder, I suffer from PCOD and irregular period. I want to get pregnant. Any tips? Work on your health, your gut health, food, diet, nutrition. Are you working on it? Milko, you had period 11th February. Today is 11th March, isn't it? How is it 5 days late? Monica, can I ask a question? Sure. Be quick. Okay, natural fertility coaching starting in April. We are still working right now. Okay, it's not that I'm only starting that, but if you don't want to wait until April and you want to start now, book a consultation. We can start now. You can still join that coaching afterwards if you wish. Natural fertility consultation, if anybody is looking for you and your partner, you have had a complex, I think most of my patients have had complex histories, because most of them came after long-winded traveling, everything else, and been through a lot of life experiences, and then they think, okay, what else can we do? And that's how most of the case studies that I have, patients that I've helped, are like that, right? So you can also reach out if something is not working. I'm getting great results this year because I'm working more deeply with my patients and I'm doing more coaching with them, and it does make a difference. Coaching makes a hell of a difference, or heaven of a difference, to have a practitioner who's on your side, or to have somebody you can text, message anytime you feel stressed out and you have a question you want clarity about, and you can work on your own stress levels, and you can know how to be in that positive frame of mind most of the time. It is it is support like nothing. It is so crucial. And just to say that, oh, just by relaxing you get pregnant, it is not as simple as that. But relaxation has a major part to how your whole body functions, your body and mind functions. Is 39 too old to get pregnant? No. Irregular period? Right. What's the question with irregular period? Is it okay to period for an hour, stop when having PCOS? With PCOS, yes, sometimes periods don't even come, depending on so that means if you're not having a period, or period starts, or just a day of a period, it is not healthy. So working on your PCOS would be the point. Phoenix, we are not doing psychic readings. Guys, this is not a psychic reading live. My God, please read the instructions on the live. Okay. Coming. Any food recommendations for conceiving? Tell me about what you eat. Zoha Khan, what shall I do with PCOD? Tell me what's your biggest weakness in eating. The biggest weakness, biggest craving. Suffer from irregular period. Julianne, irregular period is not natural or normal, okay? Whatever that irregular period is. Period could be regularly irregular or irregularly regular as well. So there are lots of variations in menstrual cycle. And the idea that it is irregular, are you ovulating? If you're trying to get pregnant, how is the rest of your health like? If your period is irregular, are you sleeping better? Are you sleeping properly? Are you pooing properly? Are your stools regular? Is your gut regular? Are you eating regularly? How are you working on your health? Sweet craving for me and snacking, right? So that is the problem, right? Zoha Khan? PCOD, and you can't have sweets. I do everything. What is everything? Tell me what is everything. Right, time to go. Thank you so much for being here. I am sharing and talking a lot about natural fertility coaching that is going to start because it is free for first 4 weeks. I'm offering first 4 sessions free for everybody, okay? So you could be in any part of the world. You and your partner both can join. Learn what is there to learn, some foundational stuff for you to this, and I can guarantee you don't know about this information, which is about your body and mind composition, your body and mind personality type, your foods that are good or bad for you. That is the foundation of everything. And then you can either take that information and do it yourself, or you can continue work either with coaching, consultation, herbal medicines, whichever way you want to go, you can do that, right? So inquiry at ashishveda.uk, send an email or directly message me here. Still waiting, pretty please? What is waiting for? Is ovulating, cramping normal? No, most of the people don't know they are ovulating, right? Anybody who has asked a PCOS question, first thing you need to do is either find any natural practitioner. In addition to, if you have a gynecologist, if you have another specialist, medical specialist, if you have got GP on your case, in addition, you need somebody who can advise you about your diet and lifestyle changes. Everything in and around you, how can you change that? And you need a practitioner who can work with you. So a lot of people said sugar craving or sweet craving, that is, you can't have sweets. When you're trying to work with the PCOD, when you have insulin resistance, you can't have sweets, anything sweet. So find a practitioner and work with the practitioner. That's my biggest advice. Join a natural fertility coaching. Inquiry at ashishveda.uk. My name is Ashish. My clinic is called Ashish Veda. We are based at number 2 Harley Street in central London. And I have been supporting women and couples who are trying to get pregnant for last 10 years and been through all different types of complex cases with great success. And right now I'm waiting for few results to come through, and then I will share them with you. So thank you guys. Tada, bye bye. Have a wonderful rest of the day and speak soon.